Good day, dear colleagues. It's conversations about hearing. Today's topic is the tinnitus problem, and today we will speak with Mohammad Sharaf, who got her master's degree at Faculty of Medicine, Wuerzburg University in Germany, and Faculty of Medicine at Ain Shams University, Egypt. She developed and standardized of new Arabic speech test battery for assessment of cochlear implanted toddlers. And now Mona is assistant lecturer in Audiology Department, Ain Shams University, Cairo, Egypt. Hello, Mona.
Hello.
Thank you for having time for us. And my first question to you is, how do you understand what the tinnitus is, and how do you define the nature of tinnitus for your patients?
How I understand the tinnitus, simply as a physician, I deal with tinnitus as being a symptom. It's not a disease. It's a symptom, and my role is to define or to find what's the underlying cause of these symptoms, and mainly to exclude the serious causes of symptoms. How I define the tinnitus to my patient, depends mainly on the underlying cause. So if I excluded all the serious causes, I will define this as being a very simple symptoms, and we can deal with it. If I find the cause behind the tinnitus, I will define the cause of the tinnitus to my patient and how to manage or treat these symptoms or the disease behind this symptom.
So you talked about the exclusion, some serious causes of tinnitus. So what we have to rule out first in patients with tinnitus symptoms?
Simply, I used, or personally, I used the classification which classify tinnitus into two categories, the pulsatile tinnitus and non-pulsatile tinnitus. Because this classification is very clinical and very simple and very easy to the patient. So I asked my patient if it's pulsatile or not. If it's pulsatile, I will look if it's arterial or venous. And according to the finding, I will order the investigation to the patients. For example, if I have patient with pulsatile tinnitus, roaring in character, for example, and I did simple neck pressure, I found that the tinnitus disappeared, then I will order CT, for example, or CBC, something like this, because my suggestion in this case will be the presence of a high jugular bulb, for example. If I have pulsatile tinnitus, which is not compressible, I will think about something like glomus tumor. So according to the character of the tinnitus, I will be guided for further investigation. If it's not pulsatile, I will search for something like otitis media with effusion, something like noise exposure, something like sensory neural hearing loss. But if it's, for example, unilateral persistent for long duration, not pulsatile in this case, I will order MRI to exclude acoustic neuroma. So by using this simple classification, I will be guided for further investigation and for further suggestion. And according to what I find, I will go for the investigations. So the main serious problems behind the tinnitus in non-pulsatile is the acoustic neuroma, the pulsatile is glomus tumor.
Thank you. Mona, there are many possible causes of tinnitus.
But I would like to add something that common is common. Always common is common. Very simply, when the patient come to the clinic and say, I have tinnitus, sometimes I ask him, did you expose your ears to loud sounds? And most of the patients, they say, yes, yesterday I was in a party and there was a very loud sound and so on. So we have to be oriented that common is common and to be easy and not to go for further investigation except we have signs that we have a serious problem.
Yes. You mentioned that there are many possible causes of tinnitus. There are many diagnostic methods, but when we have to stop our searching and say, we don't know the etiology and you have to put up with tinnitus.
It's simply after excluding the serious problem by history. First history, second history, third history. History is very, very, very important in this case. Then after doing the hearing tests, some neurological tests, and after excluding the serious problem by the clinical examination, investigations, and at first history, then we have to stop. Sometimes in a good percentage of people, we don't know what the cause behind the tinnitus exactly, what's the disease behind the tinnitus. And at this moment, we have to stop and to deal with the tinnitus itself as a symptoms to relieve the symptoms, but after excluding, of course, the serious problems.
When we talk about the tinnitus combined with hearing loss, honestly, I personally feel more comfortable treating these kind of patients, don't you? What solutions do we offer them?
Of course, this is one of the simplest cases of tinnitus to have hearing loss with, because you reach the diagnosis and at the same time you have the solution in your hand. This is very simply by offering the patient hearing aids. The hearing aids offer the patient two main solutions for his problem. First, it gives him something like sound therapy. He hears in a better way, and this sound therapy will suppress the tinnitus. And most of my patients who had tinnitus and hearing loss, they say to me after 1 or 2 months, yes, the tinnitus has been relieved or has been reduced after using the hearing aids, only the hearing aids without any other tinnitus problem. The other thing which is very important with hearing aids is that hearing in a good way will improve the emotional part of tinnitus. Because the patients who had hearing loss, they are suffering of two problems, not only the tinnitus, but they have some difficulty in communication. And this stress that caused by difficulty in communication will aggravate the tinnitus. So by offering hearing aids, we reduce the stress that aggravates the tinnitus, and also we offer the patient sound therapy for the tinnitus. And of course, we solve the problem of hearing loss.
Yes, you mentioned this.
What do you think about this?
Yes, I think the same way.
Do you agree?
You mentioned the several options for tinnitus management in hearing aids, not only amplification, but also sound therapy, tinnitus masking. Do you use them often, and how much they're effective according to your own experience, and are there evidence-based publications on that regard? I mean, sound therapy strategies, tinnitus masking in different hearing aids, how much they really effective?
Okay. Personally, I found that tinnitus masker is not so much effective. Hearing aids for me is better, or sometimes it's enough. I don't go for tinnitus masker except for very, very few cases. When the patient, when the hearing aid is not enough. This is in the case of the presence of hearing loss. Of course, tinnitus retraining therapy is optimum options for patients who have an anxiety with tinnitus. when the anxiety is not relieved with simple management like the hearing aids or the tinnitus masker. Of course, but we need here a psychologist or psychiatrist to do the tinnitus retraining therapy. Sometimes I combine the tinnitus retraining therapy with hearing aid in a very simple way, without the need for psychotherapy, because the tinnitus retraining therapy depends mainly on three items: changing the emotions of the patient, or validating the emotions of the patient, changing the thoughts of the patient and the behavior of the patient. So in a very simple way, I will explain to the patient what is the tinnitus, to change the thoughts about tinnitus being a very dangerous symptoms or so on. I can work on this thought during the session, and explaining the patient not to stay in silence, to use something to sounds behind him, to use the hearing aid regularly, and so on. This is a very simple way in counseling for the simple cases, the patients who don't have a severe degree of anxiety. But if I have a patient who have severe degree of anxiety and hyperacusis, then I will refer to psychotherapy to start the tinnitus retraining therapy. Of course, it's effective. This is not only my opinion. This is the guidelines of American Academy of Otolaryngology 2020. They also recommend tinnitus retraining therapy is highly recommended in this guidelines. And I think many physicians also agree that tinnitus retraining therapy is very effective, even more than tinnitus masker.
Mona, more challenging situation when the subject with tinnitus do not have any degree of hearing loss. Which strategies do we have in cases of normal hearing?
As we said before, we have the tinnitus retraining therapy. Of course, there are many lines of management if we excluded the serious causes and if we don't have hearing loss. There are several lines of management, like the medical treatment, some medications, or tinnitus retraining therapy, or tinnitus masker, as we said before. However, in the guidelines, they recommend against the medications and recommend against the aquapuncture, paramedical lines for treatment, but they recommend the tinnitus retraining therapy. So we have many options, and this is depend on several items. First, the presence of hyperacusis, the degree of anxiety, the degree of tinnitus, if the patient fall in sleep or not. There are many options. We have to assess the functional and emotional part of the tinnitus in each patient to select the line of proper management.
Tinnitus in children, it's a very uncertain area. On the one hand, we probably underestimate this problem because small children won't complain on tinnitus as usual. On the other hand, if the child complains, we don't always know whether this symptom worth or to paying attention or not. So what are the modern approaches for kids with tinnitus?
I have to see that tinnitus in children is not a rare situation. And yes, we have to pay attention for tinnitus in children. Okay, if they pay the attention, we don't lose something. But if we don't pay attention for these symptoms, we will lose some patients. So we have to pay attention. And the children are very nice to express them. Some of my children, I hear something like beard in my ears and so on. My ears are ringing. So we have to pay attention. And as I said before, as in adults, common is common. Sometimes tinnitus especially in older children who use the headphones and the mobile phones. They hear music in a very loud sound, and this is maybe tinnitus, maybe the earliest sign of temporary threshold shift or noise induced hearing loss. So we have to pay attention. We have to ask about the common causes. Otitis media with effusion is also very common. And what is very common also in children is migraine. So some of the children, they have recurrent attacks of headache or recurrent attacks of vertigo, and they are complaining of tinnitus. So we have to ask about the common causes of tinnitus in children and to pay attention to this. Yes.
There are many methods of traditional medicine, like acupuncture, homeopathy, chiropractic, which are thought to decrease or even treat tinnitus. Also, there are a variety of drugs which might be prescribed in tinnitus cases, like ginkgo biloba, betagestine, which of them have proven efficacy. And do you think that sometimes it's reasonable to prescribe, let me say, useless drug or procedure for tinnitus patients as a psychotherapy?
Okay. At the level of the guidelines, I said before that they recommended against those. They are not recommended anymore. But at level of the clinical practice, sometimes giving the patient something like ginkgo biloba or so will relieve the symptoms. I don't know if it's this result have a psychological part behind or not, but sometimes it's effective. At the clinical level, I said at the guidelines, they recommend against. Also, some of my patients used something which is called cupping, the cupping. Here in Egypt, we use it, and some of my patients told me they improved with cupping. There is no evidence that cupping is effective. I'm not sure, but that's what I heard from my patients. Of course, I told you that sometimes I apply the tinnitus retraining therapy in a very simple way in the clinic without referring to psychotherapy, just by explaining what tinnitus is, what's the relationship between tinnitus and the limbic system, and how the emotional part of tinnitus play a role in aggravating the tinnitus, how to change the patient behavior by not staying in silence, by use some relaxing music at the time of the sleep, and so on, and this work. But if we have a severe case, we have to refer to a psychiatrist. This is, of course. And I would like to ask you, what about in your country? What's the situation? Do you think that
sometimes if you have very anxious patient with tinnitus, and we have excluded all of the severe causes of the tinnitus, severe etiologies, sometimes
yes,
it's reasonable to prescribe, I don't know, ginkgo biloba, massage, physiotherapy, something to reduce anxiety in patient, to feel that we do something with the patient. Because if we prescribe nothing for patient and just say, so put up with it, there is nothing to do with your tinnitus, try to adapt, try to listen to music, try to listen to sea noise and something, it's nothing for patient, and this patient will go to the homeopathic, to the other doctors to get some prescription. So I think it's better for audiologists to prescribe something safe and probably useless, but to control this patient, to monitor him, not to miss something severe, not to miss progressive hearing loss, for example. That's my own opinion, but again, it's not in the frame of the evidence-based medicine, to be honest.
Yes, So we agree with each other that sometimes the evidence-based medicine do not work in some countries or in some culture. Yeah.
Yeah. Mona, you mentioned psychiatrics and psychotherapy, but for example, in our country, for some patients, visiting psychotherapist or psychiatrist is a big stigma and barrier. They tell us, I am not insane. I don't have to go to psychiatrist. Why do you prescribe me to go there? What would you recommend in such cases?
First of all, the patient who has severe form of tinnitus, he needs help. And at a point, he will agree to go to the psychiatrist. The patients who are truly in suffering, they will go to the psychiatrist. But before this stage, as I told you, we can do some assessment by using the questionnaire, the tinnitus stress scale, visual scales, and so on. And most of patients, they are not in the severe degree of an anxiety. The patient who has severe degree of anxiety, who they fail to sleep, fail to function, fail to go to work, they will go to the psychiatrist. If you offer them this option, they will go. But in the moderate stages, I will help the patient, as I told you, by changing the three items of, or by modulating the three items of tinnitus retraining therapy. Simply, I validate the patient emotions. I tried every effort I have during counseling to change the thoughts about tinnitus and the behavior about tinnitus by counseling. And this works really in many patients. Maybe after 1 month, maybe after 3 months, but it works. This will work only in patients who had moderate or mild degree of anxiety, but in severe degree with functional barrier and physical barrier, no, I will offer psychiatrist, and most of the patient who has severe degree, they will go to the psychiatrist because they fail to sleep, fail to go to their work, fail even at the social level, so they will take the offer to go to the psychiatrist. And simply, I told my patient that tinnitus is like the watch you have. It's present and it will be present, but after some time, if you change the behavior with your symptoms, you will get used to it, and it will be no problem at all, like the watch you have or like the ring you have. This is work.
Mona, what's your attitude to smartphone apps for tinnitus management?
I'm totally in love with it. Totally in love with it. And I tried it several times and it worked. And one of the important causes that I like the apps of tinnitus, that the tinnitus masker here in Egypt are very expensive. And when I tried the tinnitus app, they have many options, a huge variety of sounds. And when the patient use the apps, which is free for most of them, it worked. Very simply, some of the patients uses the relaxing music that's present in this app, or the sounds of the sea, or the sound of the white noise, whatever. And they, I remember one of my patients told me, this app is very important. It helped me to sleep again. So I'm totally in love with those apps. Really.
I totally agree with you. So, Mona, thank you for this interesting conversation. I think we discuss tinnitus a little bit because it's endless topic, absolutely endless, and there is a congress about tinnitus this year. But anyway, I think our colleagues will find this conversation interesting and useful. Thank you so much, and see you.
You are welcome. Thank you.